Nausea and vomiting are the most negatively anticipated side effects from chemotherapy, so having effective treatment options to manage them is hugely important, not only for physical patient outcomes, but for their ongoing mental health during a particularly challenging part of their lives. Chemotherapy and radiotherapy can cause damage to the cells lining the gastrointestinal tract, which can bring about vomiting. First, 5-hydroxytryptamine, more commonly known as serotonin, and the chemical messenger that is responsible for transmitting the vomiting signal, stored inside the cells is released as they are damaged. Serotonin then binds the local nerves, which transmit an impulse to the chemoreceptor trigger zone and then to the vomiting center in the brain. The vomiting center is the area responsible for coordinating these signals from the body, processing them, and activating the vomiting reflex. Let's look at a case study. Richard is a 75-year-old retired builder. He worked in the construction industry for 55 years and reports that he, quote, never particularly cared for protective equipment such as masks when working with asbestos materials and concrete saws. After developing chest pain and having a persistent cough, he sought medical treatment and was found to have stage 2 pleural mesothelioma. In addition to a surgical intervention in the form of a pleurectomy with decortication, he was started on a course of carboplatin and pemetrexed as chemotherapeutic treatment, but suffered severe chemotherapy-induced nausea and vomiting as a result. In order to treat emesis as caused by chemotherapy, one must first look at what specific kind of chemotherapy the patient is undergoing. Different chemotherapy drugs have different associated emetic risks, and therefore different optimal treatment strategies. Because carboplatin poses a moderate risk to cause emesis, antiemetic treatment that should be used for Richard is the combined use of metoclopramide, dexamethasone, and palonosetron. Metoclopramide works by blocking the action of serotonin in the brain, where it causes nausea and vomiting. It also increases muscle contractions in the stomach and upper intestine, increasing gastric emptying. Dexamethasone, meanwhile, is one of the synthetic glucocorticoids that is used primarily as an anti-inflammatory drug. For more than 30 years, dexamethasone has been suggested as the first-line drug for preventing low-level emetogenic chemotherapy and radiotherapy-induced nausea and vomiting. Dexamethasone's mechanism likely works through an interaction with the neurotransmitter serotonin and receptor proteins tachykinin NK1 and NK2, but its precise mechanism is unknown. The final drug, palonosetron, is an example of a serotonin receptor antagonist. In an antiemetic context, serotonin antagonists are drugs that have the ability to block serotonin from activating 5-hydroxytryptamine 3 receptors on the nerves that transmit vomiting impulses from the gastrointestinal system to the brain. There are 5 of these drugs on the market, but palonosetron is the only example of a second-generation serotonin antagonist. In 2010, Bottrell et al. Did a systematic meta-analysis looking at the relative efficacy of palonosetron to the other serotonin antagonists in both acute and delayed chemotherapy-induced nausea and vomiting. In order to ensure that their results were as valid as possible, they included only randomized control trials, which unfortunately meant that they had an N of only 5. However, patients treated with palonosetron still had significantly less emesis and equivalent side effects to the other drugs. The drug is primarily given intravenously, but oral formulations are available, though they are less effective and only given to patients with acute nausea and vomiting. It is eliminated almost entirely through renal processes, though it is notable that its half-life is unusually long for a serotonin receptor antagonist, as long as 100 hours in some patients, where the other drugs can have half-lives as short as 2 hours. Chemotherapy-induced emesis can also lead to more medication, doctor visits, and hospitalization costs, increasing the economic burden on the healthcare system. A recent systematic review of the scientific literature has found that whilst newly introduced palonosetron has higher initial costs than the other serotonin antagonists, in the long run it can reduce costs due to its efficacy. Unfortunately, chemotherapy-induced emesis is a distressing side effect of cancer treatment, and it can lessen the patient's quality of life significantly. It also recurs relatively frequently with chemotherapy patients and can lead to other side effects, including poor nutrition, dehydration, electrolyte imbalance, anorexia, and anxiety. Furthermore, it can also negatively impact daily functioning and leisure activities. However, possibly the most concerning impact arising from the induced emesis is the potential for it to cause patients to refuse ongoing treatment, decreasing their chances of survival. these effects can be significantly reduced or even avoided by using an appropriate antiemetic regimen.